Thank you. So we know from what Roger and Vince have been saying that a lot of the money they have to spend in their council goes on adult social care. And even with all that money being spent, there are still 1.5 million unpaid carers in the South East looking after loved ones. We thought they deserved a voice too. Pete Humphries has been to Wateringbury near Maidstone.
Who can I turn to when nobody needs me?
Peter and Jacqueline Church have been married for more than 60 years, and he's been caring for her since her Alzheimer's diagnosis in 2018.
She's a good patient, which helps a lot, and has her up days and down days. But we're still together.
Today, they're both at a coffee afternoon run by Crossroads, a charity for carers in Kent.
Crossroads has been a good help to me, and I think they're an organisation that helps people to be aware of the carer.
Dee and her husband Florus got together in the late 60s.
Long story. He picked me up off the beach.
During her career, Dee worked in a clinic for dementia and Alzheimer's patients, but she says seeing her husband diagnosed is completely different.
It's quite taxing emotionally and mentally, especially caring for my husband. I think it might have been a little different if it was for someone I didn't know, if it was like a job for me. But caring for your spouse is really very different. It's very emotionally taxing, you know. So, yeah, from that point of view, I think help is going to definitely be on the horizon.
But for unpaid carers, that help can be difficult to access.
It's depressing, to be honest, yeah, at times. And if you were to ask me what I really need most, that would be some respite care at the right price. Just for a day sometimes, or 2 days, one night over. All those sort of things just are not available. If they're available, they're hard to come by.
The whole of social care is in crisis. Social care is having a horrific time recruiting, so there simply aren't enough staff around. It has an enormous negative impact on unpaid carers because the reality is that they were struggling before COVID. COVID made it even worse, and coming off the back end of COVID, we're now into a cost of living crisis where they don't know whether they're going to continue getting any support, they don't know whether their home is going to be secure, they don't know whether their heating is going to be secure.
Despite the challenges, the government says it's spending nearly £300 million this year on providing breaks and respite for carers, and will be boosting the budget councils have to spend on social care by £2.8 billion. But everyone we spoke to here at Wateringbury agrees it's essential that unpaid carers get the support they need.
It's vital because without the caring people, these people will be in hospital beds or going to a care home early and just not having a life. The biggest problem with the carer is to try and keep life as normal as possible, and that's a hard job.
That was Dennis ending our film there. Roger Goff, what help is there available to unpaid carers in Kent? Does the County Council provide respite?
There is help available in the sense that under the Care Act, carers can request an assessment of their needs,
yes.
And from that there can be support in terms of respite. There can also, it depends on very much on the circumstances, but there can also be support in terms of respite that is needed from the point of view of supporting the person who is cared for. Now, I won't pretend it is anything other than a very, very difficult area. What we did bring forward earlier this year was, and I appreciate local government is always guilty of strategies of one sort or another, but there was a carers strategy very much focused on that, and we're looking now to bring in the operational elements of that.
Yeah.
Now, all this, I'm afraid, to go back to what we were discussing earlier on, is within that context we were describing.
Yeah,
but we absolutely recognise the point that was made. We rely on carers.
But so let me ask Vince this, but I'm sure it's something you can come in on as well if you want to, Roger. Vince, if you can pay, does the situation change? I mean, some people might be able to. Or do you think it's a shortage of carers per se that's the issue?
I think it's a whole combination of stuff. So Carers UK did some research, and actually more than 50% of unpaid carers have had no break for the last 5 years. And I suspect that sometimes because actually it's complex to organise, sometimes it's because perhaps it's not to the level they would want. And actually in some cases it's probably because they don't want to and don't actually realise that actually having that respite and break is good for everybody.
Some people feel like a failure when they ask for help, don't they? Because they think this is my wife and it's my job to look after her.
Exactly that. So I think those statistics are pretty stunning, but actually I recognise that you've got to dig a bit deeper, and it is tough, you know, for families, particularly. Sometimes those carers themselves have health conditions, so this is not a straightforward set of circumstances.
We heard it from Crossroads in the film there, Roger, and they've told us that the contracts you give them are so short term, it's difficult for them to plan for the future. Is there any way of giving them more certainty around budgets?
I think certainly for this year, the contract has been relatively short precisely because we're trying to align a whole number of other plans. I do agree, actually, that in many circumstances, moving towards longer-term arrangements does make more sense, but there is a particular reason for that, and it's something that we are now looking to a whole number of things. One is the financial situation we described. The second is we've been doing a lot of work about our relationship with the voluntary and community sector and how we can try to move to a different and better model of how services are bought in and provided. But that's not going to happen quickly, but it's a really important piece of work.
Vince, there's a risk, isn't there? If there's not enough support for unpaid carers, it falls back on the councils to pick up the slack, doesn't it? And then this awful vicious circle keeps going around.
That's true, and again, some people would want to do that care themselves personally, even if the council was in a position to say we can give you unlimited support, they'd still actually know it's the right thing to do. I think one of the challenges is for the workforce as well, the care workforce. My friend and colleague Teresa Murray talks about this often. Actually, you know, we've got a situation across the UK where carers, paid carers, are now being paid less than those who perhaps are working in retail. And that's not to say that's not good for retail, of course, but actually carers are looking after our most vulnerable people. So even if somebody was looking for some additional support, if they're an unpaid carer, the resources are limited, and actually the staffing levels, the labour levels are limited as well.
Do you agree, Roger, that that's a real issue? It's just very quickly, we're nearly at the end of the programme, but just how the role is perceived in our society.
I think there's everything about how the role is perceived. There is clearly an issue about what is paid, and there are issues about career prospects in that. Now, I think there is a major piece of work going on, and in fact the Chancellor, of course, has been very keen on health and care workforce and how you develop it. That is actually probably the biggest single issue, both within care and indeed within health as well, in terms of developing those career pathways such that we overcome some of the problems we've got, especially in care, on recruiting and retaining people.
Great to have you both with us this week. Thank you so much for your contributions. My thanks to our guests, Roger, and to Vince, and to Charlotte, our political editor.